You know that moment, that little voice of worry that pops up after a sexual encounter, making you wonder, when is the right time to get tested? Getting an accurate sexually transmitted infection test is crucial for your health and peace of mind. The direct answer is that there isn't one single timeline for all sexually transmitted infections, or STIs. The number of days you should wait to test after exposure varies significantly, depending on the specific infection. It is truly essential to understand these different timeframes to get the most accurate results possible. This variation happens because of something called the window period. The window period is the time it takes for an infection to develop to a point where a test can reliably detect it. During this initial phase, the infection might be present in your body, but your immune system has not yet produced enough antibodies, or the virus itself has not replicated enough for a test to pick it up. Testing too early, within this window period, can unfortunately lead to a false negative result, which means you might be infected but the test says you are not. For common bacterial infections like Chlamydia and Gonorrhea, tests can often detect the infection within 1 to 2 weeks after exposure. However, some healthcare providers might recommend waiting up to 14 days for the most accurate results, especially if you have no symptoms. For viral infections, such as HIV, the window period is usually longer. Many rapid HIV tests can detect an infection within 3 weeks to 1 month after exposure, while some antibody tests might require waiting up to 3 months for full accuracy. Herpes testing, if you develop symptoms, is usually done by swabbing a sore, so the timing is more about symptom appearance than a fixed window. An important insight is that some infections, like syphilis, can have a longer window period for certain types of tests. While a blood test for syphilis might be reliable after 3 to 6 weeks, it is always a good idea to consider retesting if you continue to have concerns or if your initial test was very early after a potential exposure. Retesting can provide an extra layer of certainty. Additionally, remember that some sexually transmitted infections like human papillomavirus, or HPV, are often diagnosed through routine screenings or when symptoms appear, rather than a specific post-exposure test window. Understanding these specific window periods empowers you to make informed decisions about your sexual health. Knowing when to test ensures you get the most accurate information about your status, allowing you to seek appropriate treatment quickly and protect your partners. Always communicate openly with your healthcare provider about your exposure and concerns, as they can guide you to the best testing schedule for your individual situation.